Hi, I'd like to spend a few minutes chatting with you about equipment needs in preparation for your pet's orthopedic surgery. My name is Amy Lamoureux-Hesbach. I'm a physical therapist and certified canine rehabilitation therapist and practitioner based in Massachusetts in the United States. First and foremost, we need to take a look at flooring. So if you have carpeting, fabulous. If you have runners on stairs, fabulous. If not, I would suggest you invest in some runners, yoga mats, some type of flooring option that is non-skid and likely easy to move, easy to clean, easy to remove. This will come in handy early on in your pet's recovery from surgery, as well as throughout the recovery process. And certainly you can ask your rehabilitation provider about the length of time that you'll need to utilize these different flooring options. I'd suggest having a good stash of towels, blankets, piddle pads, etc., things to wipe up spills, accidents, to absorb any drainage or issues from the surgical wound, at least in that immediate post-op period of time. We want your pet's bedding, an area where they're resting and recovering, to be clean and dry. And so having a supply of these will certainly be helpful to you. Harnesses are key in recovery and rehabilitation when your pet is learning to walk again, learning to use all four limbs again. I suggest a harness that is not restrictive of the shoulders, so has some clearance at the shoulder, maybe has a handle that you can hold on to depending on the height of your pet and the length of your arms. These harnesses are fabulous when it comes to trying stairs for the first time or different grades, ramps, hills, etc., in helping to control your pet's speed and allowing them to what we call weight bear as tolerated. There are a variety of harnesses available. You may already have one for your pet that they're used to wearing. Some other options might include this harness lift system by Orvis. There are some harnesses by Roughwear, by Papilla, by Help 'em Up, and others. Again, I would suggest asking your rehab professional their advice with regards to the type of harness that will fit your pet and your specific situation. Having a leash. Your pet might be familiar with or used to being off leash indoors and outdoors if you have a fenced area. But now is the time to introduce a leash or reintroduce a leash. My suggestion is to use a short leash, so 6 feet, 10 feet at the most, one that has a controlled length, not a retractable leash. Retractable leash is less predictable. Can lead to injury to you or your pet because of the width of the leash itself. I've seen actually a fair number of pet owners in physical therapy who've had injuries because of retractable leashes, and not just those pets that have had those injuries. So if you consider the rehabilitation process and recovery process, the key is control and safety for both you and your pet. And so using a leash, not just outdoors, but potentially even indoors with your pet as they're recovering from surgery and going through the rehabilitation process is certainly a good idea. Your pet might require a sling, especially a pet that is larger, that you can't carry on stairs, that you can't lift in and out of the car using your hands or your arms. A sling is a fabulous way to provide some body weight support to your pet in a comfortable way. There are certainly commercial slings available that go under the belly. There are others that are incorporated into harness systems. You can actually create one yourself. For example, in this figure here, out of a canvas or a recycled plastic reusable shopping bag, where you basically cut the seams of the bag, use the handles that are securely attached to the bag to help your pet to weight bear and to help to control their speed, maybe even to help them with their transfers coming up and down from a sitting or a lying position. I'd suggest using a kennel, a corral, a baby gate, some type of fencing to block off areas of the home that are unsafe for your pet. We want to restrict their mobility after surgery, maybe not 100%, but certainly keep them safe. We don't want them running from one end of the home to the other. And a lot of our homes are very open floor plans now. And so using these fences or baby gates to close off certain areas of the home while they're recovering is certainly a good idea. Some surgeons do like pets to be kenneled right after surgery and for a period of time after surgery. You want that kennel to be large enough that the pet can stand up, turn around, even to access potentially food and water while in the kennel. Not so big that they can run from one end to the other. I do like corrals and fences because they do, kind of give the pet a bit more security, allow them some interaction socially, and have kind of a designated sleeping and eating space. Your vet might prescribe an Elizabethan collar or an e-collar. That's our cone of shame, plastic or a softer kind of foam, or potentially an inflatable type of collar to prevent your pet from licking at a surgical wound. Some might allow these wound covering garments that kind of cover the wound and protect the pet from licking and protect that wound from any further injury. The concern about these garments is that we have to put them on and take them off. We have to keep them clean. And so if your pet has had orthopedic surgery, maybe of a hind limb, and we have to put that garment on the limb, your pet might be very resistant to handling and to the mobility that's necessary to actually put this garment on and off. So you certainly want to consider these things when making a decision about that e-collar or wound covering garment. I'd suggest getting an ice pack or a hot pack, maybe not one that you utilize. It might be one that's disposable, might even just be a bag of peas, obviously that you're not going to utilize in the future. You can create your own ice pack with rubbing alcohol and water and Ziploc bags. You can use hot compresses. Certainly we want to protect the skin and protect the wound when applying a hot pack or a cold pack to the pet. We want to be sure that it is clean and dry and not providing any source of infection for the pet or for that wound. So that's a simple shopping list for you, some supplies and equipment that can be helpful in that immediate post-op period. Obviously, if you have any questions, any concerns, or any thoughts about this list, I'd love to hear from you. My contact information is here, and best of luck. We'll see you again soon.